Okay, in this situation, we have what appears to be an older, more experienced nurse who is precepting a younger or less experienced nurse. The older nurse is being extremely rude to the new nurse right in front of a patient. This type of behavior is detrimental to the new nurse's confidence and morale, as well as to the safety of the patient, because in addition to being rude, the new nurse is being encouraged to disregard safety precautions. According to Sullivan, page 284 and 285, the American Nurses Association, as well as the Joint Commission, both recommend a zero-tolerance policy for bullying behavior in the workplace. A manager has an obligation to intervene in cases of incivility and bullying behavior, and I would think especially in this case, because the more experienced nurse is trying to coerce the new nurse into disregarding safety precautions, which is probably against policy and definitely increases the risk of harm to the patient. Worse, she does this right in front of the patient himself, which really makes the whole organization look bad. The manager should act immediately to confront the nurse who is responsible for the bad behavior, to let her know that this is unacceptable and will not be tolerated. She might want to speak to her at length to find out what, if anything else, is going on, and really to consider if this nurse is fit to be precepting new nurses at all. The new nurse in this situation should be encouraged to keep doing the right thing and be encouraged to speak up if there are any further incidences of bullying or incivility. A leader in this situation can really be anyone who's willing to stand up against the type of behavior that is occurring. Another nurse who overhears them, for example, might stand up for the new nurse or offer to observe her giving her medications in place of the nurse who's being so rude to her and who is encouraging her to be unsafe. A leader might also report the incident to the nurse's manager or supervisor so that this behavior can be further dealt with. According to Sullivan, page 122, cultural diversity affects issues of incivility in the workplace in several ways. Employees with different cultural backgrounds may give and receive communication cues in different ways, and a manager should be aware of these potential differences without making blanket assumptions. In addition, employees and patients, for that matter, who are in different age groups may have different expectations and methods of communication that work best for them, and a good manager will be aware of these things and take them into consideration when communicating with these employees. Thank you.